Leadership Flavors lecture. We have an illustrious panel of two CEOs, Manoj Saxena and Anish Krishna, who shall be deliberating on a very interesting topic, Bayer, the legacy of world-class healthcare. Before we have the pleasure of listening to their interesting conversation, let me have the pleasure of introducing both of them and both of our guests today. First, it is Manoj Saxena. Manoj is Managing Director at Bayer Pharma for the last 14 years. And before this, he was at Cipla for 12 years and 8 months, where he worked. He was the commercial director. And let me also have the pleasure of introducing our second guest and CEO of TimesPro, Mr. Anish Krishna. Anish is a graduate of Asian Institute of Management, Manila, Philippines, and he is also a member of governing body of Bennett University. He took over as CEO of TimesPro in 2015, and since then he has led the rapid growth and scaling of the company in higher education. Over to you, Anish.
Thank you, Doctor, and thank you, Mr. Manoj Saxena, for agreeing to be part of this Leadership Levers seminar today. I know we chatted earlier, and you had mentioned that you come from a family of teachers, and you'd be really interested in sharing your experience with us, with our students. So thank you very much for that generosity and that spirit. I'll keep in mind that you would like to have a lot of questions from our students and from various participants in the webinar today. With that, Manoj, I will get into the meat of our conversation with your permission. For the first time since the pandemic of 2020, we have seen that a health crisis has been responsible for the shutdown of the global economy. And this is demonstrated quite painfully, but also quite insightfully, how inseparable, core healthcare is from the economy that we have for us at the global stage. We've taken one or the other for granted through the last 50 odd years, perhaps since the last pandemic in 1918. But it's just kind of bounced back hard. So one of the questions that keep coming up is, has healthcare intrinsically become one of the most important criteria for governments and for society in general as we plan our way forward? The pandemic has also seen a dramatic demand for healthcare, and this demand has ranged from ICU beds to oxygen tanks to vaccines, and it has just demonstrated sometimes the need for an agile, vigilant, and world-class healthcare system, and above all, for the need for the world, especially the developing world, to have access and affordability to quality healthcare. Having said that, Manoj, I'd like to structure our brief conversation. We have about 30 minutes, is what Dr. Chaudhary has told me. So I'm just trying to look at a broad 3 segments in which we can structure our conversation before opening it up to the audience for questions. The 3 segments that I had in mind are, number 1, building a world-class healthcare system. Number 2, role of an emerging digital in the whole healthcare equation and what that means for healthcare systems and startups. And lastly, to talk about your company, Bayer's, unequaled 160-year legacy in sustaining, systems of healthcare around the world. So, with your permission, Manoj, I'll jump into our first segment. And yeah, hi, Manoj. So, with your permission, let's get into the first segment. Manoj, we've seen that one of the most liberally and perhaps not so correctly used words in our business lexicon is, the word world-class. So what, according to you, is world-class when it comes to healthcare system, both in the context of India, where we have issues of access and affordability of quality healthcare, where that itself is a challenge, and also in the context of a developed world, where again the pandemic has thrown up questions of what constitutes a world-class healthcare system.
Yeah, no, thanks, Anish, first of all, for having me. And I was happy since this is a fire chat and you started with Mr. Manoj and then you quickly moved to Manoj. Yeah,
My apologies.
fire chat has to be informal and yeah, but great. Yeah, great to have a conversation with you and also giving me an opportunity to interact with lots of students as well as young professionals and probably people who would like to know a little bit more about the healthcare. You're absolutely right. I think there are various stakeholders in the healthcare puzzle, yeah, and each is playing an extremely critical role towards one thing, which is giving a better outcome to the patient. Yeah. So, from my perspective, a world class means if a patient gets it treated well, yeah, or the disease is being managed well, or whatever prognosis the disease would need, he is getting the best of the treatment. Yeah. But that definition slightly changes if you add the stakeholders, right? For a pharma company, I think our desire to keep on innovating, finding newer solutions. For example, there are therapies like diabetes. Now, diabetes is well controlled, but there are complications of diabetes which are not. Yeah. And then there are within those complications, there is a niche population probably which is having a cardiometabolic disease. Yeah. So I think the pursuit to get to innovation which helps the needy patient. These could be smaller numbers in rare diseases. This could be very niche populations, but this could be mass numbers like in diabetes or cardiovascular targeted therapy in oncology. So I think having a pursuit to find innovative drugs is actually world class. From a healthcare practitioner, the ability to treat a patient with whatever is available in the market in the West, he or she also gets that for their patient, helps the patient to understand the disease, has infrastructure to support and diagnose is actually world class, right? So the ability to diagnose patients early on, whether it's in oncology, but we know there's undiagnosed disease in India and emerging market across the board. So that is world class. For a nurse, the ability to give the best to the patient, yeah, I think that is world class. So depending upon how do you state, but I think the purpose and the sole purpose for every stakeholder is towards that the patient's outcomes are. And I think that's what defines world class to me.
My apologies, I was on mute. No, that was a really succinct capture of it, Manoj. One of the themes that we have grappled with in education, and I imagine it's similar in healthcare, is the issue of access and affordability. And in a country like India, I think everything from universities and colleges who produce doctors to the number of paramedical staff that you have, to the medical equipment manufacturers, to insurance companies, all of these somewhere are part of the healthcare challenge, and they're also part of the healthcare economy in a sense. How do you view, in the light of COVID-19 and everything that's happened, how do you view the need for change in each of these constituents, especially in the light of these two themes of affordability and access to quality healthcare, in a sense, a democratic solution to healthcare?
Yeah. No, I think that's a great, fantastic question. Yeah. And at Bayer, we live with a vision of health for all, hunger for none. And I think, but let me start with what is access. And sometimes access is construed with the price or the affordability. Yeah. Access is a multifactorial thing. Price of the drug is only one factor of it. And I'll give you an example because sometimes we feel, okay, if the prices of treatment, yeah, whether it's drug devices or anything else comes down, then probably everybody can get the right treatment. Yeah. And the example is of anemia. 50% of women in India girls above the age of 15 are anemic in India. Yeah. The cost of anemia treatment is nothing much. It's probably 1 or 2 rupees a day. Yeah. So everybody could afford. So affordability or access to anemic drugs is not an issue. Yeah. From a pricing play. But still, despite 30, 40 years of drugs being available, the anemia is still pretty much prevalent in the society. Yeah. And that I think is the access challenge because we need to diagnose so that everybody gets regular diagnosis. We need patients to be, or the women to be aware of it. We need society to be also aware of it. We need doctors, clinicians, therapists, all to really help the patients not only to get the drug, but also to continue the therapy for long term. We need dietitian counseling sessions to happen so that what diet patients are taking or women are taking by and large at their home, they understand what they need for anemia. And probably then only you can address it, right? So, I mean, this is a very simple disease. Think of cancer, think of, cardiovascular diseases, think of any other complications where super specialties are needed. So I think it's a composite of lot of people working together. Yeah. And I think that is the reason why when we say for access, I think the general yardstick which we keep on using a lot is around how much percentage of GDP you spend on healthcare. Yeah. And in India, it's a established fact, and everybody acknowledges that. In fact, Government of India is also very keen to increase it. Our percentage GDP spent on healthcare is very, very less. And in fact, whatever is being spent, almost 70% is contributed by out of pocket. Yeah. So the government contribution in terms of is less, and the programs like Ayushman Bharat are an extremely good start, because the bottom of the pyramid, which when they were hospitalized, they were having nothing. So I think giving an access for them to get, when they are hospitalized, they don't have to spend their own money. They were selling land or they were going below the poverty line. So I think it's a fantastic start, and probably universal healthcare can take much more better shape with Ayushman Bharat 2.0. Yeah. Now, what is needed by, in an environment where a lot is being funded by self, I think the government can increase the GDP, but also the other stakeholders can play their part, right? In a sense, and you mentioned insurers. We have private insurers. I think the whole COVID thing, which you started with briefly, has put health as a center stage. We use, from our childhood, health is wealth. Actually, people realize during the COVID time, actually, wealth is health. Yeah. The whole wealth is, people are thinking, why should I buy 2 shirts? I'm okay with a couple of shorts at home, or people who are not able to earn any money. So in that context, I think the whole center stage healthcare came into, and probably every stakeholder, whether it was manufacturer, whether it was innovator, whether it is someone who is distributor, dispensing, pharmacies played a very critical role in making sure the patients were getting the drug. And that, I think, can further boost in terms of giving more access. Yeah. So yes, I think everybody can play an important role, provided there is enough focus on health from both the side, both from the private side as well as from the public side.
That's terrific. One of the issues that, especially in a country like India, or any developing country that we look at, is the issue of availability of doctors and the whole doctor-patient ratio, which the World Bank, which the World Health Organization has said should be 1:1,000. We, even if you count all the Ayush certified doctors in the country, we would come up to, in India, maybe 1:800 or so. And in most developing countries, those ratios would be much worse. What is, in your view, can we do as a country, beyond Ayush and beyond everything else, to sort of increase the supply of doctors, to improve the ratio of this patient-doctor thing? Because, from an urban context, it's one thing to say, hey, doctors are available. But in a country like India, in a semi-urban or rural context, finding a doctor can be the difference between life and death. And that ratio is really alarming in some areas. So what are your views when it comes to this critical ratio?
No, Anish, absolutely. I think India has done rapid progress. Yeah. So to meet WHO minimum of 1 doctor per 1,000, India is right up there, right? So I guess at least the minimum is met, which is if you look back 20-30 years back, is a rapid stride to what. And you can see the benefits. You can see the life expectancy has improved. You can see maternal mortality rates have improved. Yeah. But is it the final goalpost from a doctor density? Of course not. I think we can go much deeper. And couple of things which I think we should note is, one, 1 in 1,000 is not a number. If you look at some of the places where health indicators are pretty good, the numbers are 2 to 3, which means twice the number of doctors today what we have, and probably the work both private and public can play in to have more doctors coming in. I think today as we speak, we have the highest number of MBBS passing out from India now, and so if that trajectory can continue, so that is one. I think the urban setting, at least the primary care topic is well addressed. And you are right that the rural setting, the primary care setup is yet to be fully nurtured. So there the density of doctors is still less. So how can we go deeper in semi-urban, rural setting? How do we incentivize doctors to go to those areas? And how do we really drive that in terms of, because it's not just about sending doctors to those areas. They need a good setup. They need infrastructure for diagnosis. They need good primary care setup clinics as well, right? So probably as the GDP increases and the government would stay in, but also the private care would also go in. I think I'm absolutely certain that would have in. Lastly, I think is around the topic around not just looking at the number of doctors. There's another way also which WHO and World Bank looks at it. They combine everybody together, right? So they look at HCP, which includes pharmacists, nurse, and So I think how can we go deeper with that? And then another layer is super specialists. We know, India is now at 70 is our life expectancy. So we are already the world capital for diabetes. And the complications of cardiology, diabetes, we are seeing the aging population would have, and the diseases in India are coming much earlier than what we see in the West. We also would need secondary and tertiary care centers. We would need super specialists coming out, and the numbers much higher in tier 2, tier 3 cities. So probably that's, I think, also should be the discussion that at some point of time, how many super specialists, how many endocrinologists, how many neurologists, how many oncologists we have in tier 2 cities beyond the top 10, 20 cities in India. And I think that then only we can significantly increase the access of a quality healthcare to length and breadth of the country.
Awesome. I can see a lot of questions are flowing in. So, I will therefore move on to the next segment, Manoj, about, the role of innovation and digital in healthcare systems, and indeed a lot of the exciting healthcare startups that we keep hearing about and we keep seeing. So the term digital health is kind of an umbrella term, which includes all the applications which is coming from intersection of healthcare and technology and commerce. But from your perspective, again, there is a mission called the Digital India campaign. The National Health Policy talks about the role of digital in bringing medicine to rural areas and so on and so forth. But from your perspective, do you think this kind of an increased focus on digital health by the government is the right way to go for a country like India? Does it actually improve quality healthcare to the masses, or is it one of those startup business models that we should probably examine closely?
No, I completely think that the digital is the right strategy for India. Look, if you look back 10, 15, 20 years, maybe 20 years, getting a phone line was so difficult, right? And then with mobile today, everybody has like 2 numbers. I'm sitting in a very, very remote place in Madhya Pradesh, and we can have fantastic calls through a hotspot. I'm using my phone to get to the laptop. So I think digital is a leveler across the board, both from a hierarchy of income level, but also the hierarchy of a geography, from a urban setting to rural setting. And healthcare actually needs it. Just to give you an example, we had set up a telemedicine center, at many places. You would have seen in the media report as well that we are putting it up. And at every center, we estimated certain numbers of people who would come for consultation. This is essentially to link them up with super specialty. So a place like Vapi doesn't have a neurologist, for example, and the patient needs to refer it, they can hook it up on a telemedicine thing, and then they can consult a neurologist like instantly, right? And the numbers of patients queuing up to get that, and the number of doctors helping us to refer to those patients are massive. So I think the digital has the potential to really scale. I'm just giving you one example. It could, look at the EMR, a doctor getting a dashboard, how many times patients, what are the HbA1c level of the patients over the last 6 months or 12 months, use of AI, use of technology to actually coach and mentor patients to understand their disease or their caregivers. For example, in some of the diseases, it's important that the patients understand or their caregiver understands how, what needs to be monitored at home. Yeah. We have family planning, and it's a topic which can't be discussed in families, right? Though it's called family planning, but a young girl who is recently married can't really openly talk to anyone on family planning. Yeah. The pharmacists in India, unfortunately, most are men. Yeah. We have a chat bot which sits on Facebook Messenger. Yeah. And she can converse, ask queries, the chatbot answers privately in her own, living or bedroom, and no one knows it, right? So the usage of technology to really help both doctors, hospitals is massive. Yeah, and you've seen how telemedicine is really taking up across the board. Yeah, so I think the whole initiatives by the government of India, as well as by the private sector towards digitization, and the role which startups are playing in the telehealth is absolutely fantastic. But like any startup, I think there would be some which would not flourish, but majority I think would definitely help to become an important pivot in the improvement of healthcare in India.
Manoj, you mentioned privacy briefly. I can't resist asking a follow-on question. In an era of digital invasion of our lives, of privacy becoming an important thing, how does this speak to the level of digitization and technology that is invading medicine? I mean, we are talking about point-of-care diagnostics, personal wear kind of recording devices which are transmitting information about your health. There are so many issues there, from a privacy perspective and from protection of the patient's right, and so on and so forth, which is also linked in a way to insurance and commerce and so on. How do you see the protection of patients' privacy and rights in the context of access and affordability through digital? And what's your take on this whole issue?
Look, I think, Anish, digital is definitely not a derailer from a patient access or patients getting to the right treatment. I think, to me, digital is definitely enabler. While doing so, I think everybody who takes care, who is collecting data or who is storing records of patients or personal information has to be absolutely prudent. How do we keep that data? For example, our sales rep meets doctors. We also meet them virtually, digitally. So we have their email IDs and stuff like that. Without the consent of the doctor, we do not allow our sales reps to send them an email. Yeah?
Right.
So unless until the consent is there, and then how do we store that data is equally important. So I think privacy is absolutely fundamental. Yeah, I don't think, and particularly with patients, I think it's absolutely critical to safeguard the privacy. Yet I don't think that digital is derailing that privacy thing. Of course, there are always elements which are not using it properly. So there should be enough laws of the land, and they should be enforced if somebody is breaching those privacy. That I think is a challenge. But that's a challenge which we see in any time when we are adopting to a new technology or new processes, right? Because the policies are always 2 steps behind them. By the time you craft a regulation or a policy, now we are all talking about Chat GPT. We have forgotten something which like WhatsApp was. Yeah. So that's how the regulations would be. But beyond that, I think definitely digital is an enabler for healthcare.
Thank you for your candor there, Manoj. I'll move on now to our final section about your company, Bayer. 160 years of legacy in this field, a global enterprise, core competencies across life science fields, across healthcare, across agriculture, and just such a core organization for the world health economy. How do you define Bayer's legacy from the lens of your leadership, both as an India leader for Bayer as well as part of the global team of leaders, which is helping to shape so many things in this world
Yeah.
through its technology and its legacy.
Yeah, when I'm only 13 plus years in Bayer, an organization which is 160 years globally, more than 125 years in India. A lot of things and the impact which is created over these years to the society is immense. Yeah. So absolutely, I feel so proud to work with an organization like which has a rich legacy of 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 innovation essentially, which has been life changing and so impactful to society. Just look at aspirin. Aspirin has been there for over 120 years and still uh, extremely important medicine for a lot of patients. Yeah.
Yeah.
So I think the value of innovation and the legacy what Bayer, I think that sort of our leadership is unbeatable. We have a mission of science for a better life. Yeah. And a vision of health for all, hunger for none. These are such powerful. Every day when you go to work and you think of what you can contribute to health for all, it is so motivating for everyone. It's phenomenal. And our values, we have an acronym which is called as LIFE, Anish, which is LIFE. L stands for leadership, I stands for integrity, F is for flexibility, and E is for efficiency. Yeah? And these values are actually helping us to stay focused. Everybody has their own moral compass. I think these values help us to navigate our moral compass as to what we can do, better for the society. Fabulous legacy, and I can only be absolutely proud of the way we put Bayer on our chest. Yeah.
Terrific stuff. My team had done some research, and one of the things that comes up in the pronouncements of various luminaries within Bayer is the focus on R&D and innovation. And I think your global head of R&D, Mr. Rommel, was quoted as saying, can you actually ascribe the present to the past? And what is the choice? You don't really have a choice but to invest in innovation and in R&D. This is something which has defined a lot of legacy companies in all sorts of fields of technology. And this is an area where developing countries like India have lagged in their investment in R&D and in innovation. What's your take on this? What's your advice to Indian companies and to many of the budding entrepreneurs on this platform today on the role of R&D?
So Anish, I'm too small to advise on Indian companies. I think Indian companies have also done phenomenally well. As Bayer, yeah, which believes in innovation. And the reason is, I think our outlook is how, when we say science for a better life, I think the better part can only come when we keep on innovating. Yeah. Whether it is aspirin to a novel anticoagulant like rivaroxaban, and now we are working on something which is factor 11 again would be hopefully the clinical trials come out positive and we would be introducing it in the market. Phenomenal asset. Yeah. So this could only come with relentless focus on trying to find out what the patients need for today, not just today, but also for tomorrow. Yeah. What are the current treatment is giving them and what are the gaps? And that's the reason why we are investing significant amount of money, close to 14-15% of our top line into R&D, which is significantly high. So I guess it's each organization has its own purpose, right? The Indian companies have also done very well. India is called as a pharmacy of the world. And I think in the generic space, India has done well. How do they come up in the value of innovation? I think we have seen during COVID, a lot of companies that invest in R&D. So there is, I think that's the only thing which would come in, that how do we keep on investing in the R&D? How do we look at disease areas where there are still patients not getting the right treatment or the optimum treatment, and invest to really look at innovation. I think as an Indian ecosystem, when you look at Anisha, today where we are in India, I think we have a fantastic ecosystem for innovation. We are seeing that already with IT companies. You just mentioned about the digital tech, right? Banks have been, or the financial sector have been quite innovative. I'm sure no reason why, at what scale India or Indian companies are operating now. I think every Indian company is also looking at how do they climb up the innovation ladder. Yeah, so absolutely.
Fantastic. Manoj, thank you so much for your candor, for your patience in dealing with questions, especially some of my digressions into areas that I'm particularly interested in. Thank you so much for bringing complex issues in healthcare in a more relatable and very simple format for our listeners. Thank you for your time. Thank you for fielding my questions. I'm going to now hand back to Dr. Nagendra Chaudhary, who is wiping his brow because he's got so many questions. He doesn't know where to start. Over to you, Dr. Chaudhary. Thank you so much, Manoj.
Thank you, Anish. Thank you, Manoj, once again. We have quite a few set of questions. And before that, one question that has come up in one of the forums is that, healthcare industry happens to be one of those rare industries where, we have been talking about innovation. This is the only industry in the world where innovation has not led to the cost reduction, right? Because every other industry where you see innovation always meant another cost reduction, but this is one industry where the cost, it has not seen the cost reduction as such, maybe in treatment, maybe in the drugs, what do we call it, right? The entire eco spectrum there. So what does it take to, result the innovation in the cost reduction, Manoj?
No, actually, the costs have reduced. The whole model of, when you innovate, there is a period where the patent is, I think the cost is pretty much based on the value. And then once it goes off patent, the cost reduces significantly. To an extent, in most of the markets, the costs are down by 60-70%. So I don't know to what context the cost assumptions are, but generally with innovation, I think the costs have actually come down significantly. The cost of treatment, for example, there are many therapies. We have a product which is a very innovative product. The patient had to go for hysterectomy. Hysterectomy means a major surgery. The cost could be 50,000 to 1,00,000 rupees. The product cost 1/10 of that. So it reduces the surgery. Or removes the surgery. The patient doesn't have to get admitted in the hospital, no surgery, and the treatment cost is 1/10. So there are, of course, there are some therapies which could be expensive, but there are majority of the therapy over a period of time, actually the cost come down with innovation.
Very good. So we have a question from Mr. Dinesh, and his question is, can you please let us know the role of health economics in healthcare industry? Thank you, Dinesh.
Yeah, I think that's an important question, right? Health economics is generally around, from a patient perspective, or who is paying for the drugs, or who is paying for the healthcare. And then I think the health economics play an important role. In India, because since it is majority of things is out of pocket, the health economics, at least the calculations are done by the clinicians and the patients themselves. But for most of the places where there is a payer, it could be an insurer, it could be a government, they look at it, giving a treatment, or a approach, let's say surgery, to out of hospital care, B approach, what is the impact which would come in on the patient, but also on the society as such. So if a patient is hospitalized for 5 days, he's away from work, how does the productivity get impacted? He's coming to the hospital, the cost of hospitalization, there is a caregiver along with it. And that all costs is counted as to, in the health economics. The HTA assessment is a very common thing in the West. I think probably the Indian government is also looking at those models as they increase as the Ayushman Bharat, but Ayushman Bharat actually captures the health assessment. That's the reason why they put a cap of 5 lakh rupees, because they felt close to 400 surgeries could be covered. If I'm not wrong, 400, maybe my number could be wrong. But whatever number of surgeries are being covered in Ayushman Bharat, that they are capped at 5 lakh because they could be covered at 5 lakh rupees.
Very good. This is a question from Mr. Sanjeev. I think it's quietly elaborate. His question is, we have faced COVID-19 and all are still doing today as the environment has become today. Maybe we have to face this problem again in the coming time. Apart from this, war is going on between Russia and Ukraine. There might be many diseases related to health in the coming time. Will it make any difference to the Indian economy, and how will it affect our future and health in times to come? Thank you, Sanjeev.
I think if you look at simple data on mortality and life expectancy, you have seen that the COVID had impacted every country. So can you ignore health? I don't think so. Sanjeev, for a growing country like ours, we are the fastest growing country. And the reason why the next decade or couple of decades for us seems to be extremely bullish, and I think everybody is bullish for India, is essentially because of our average age. And when we say India is 10 years younger for getting diabetes, 10 years younger for getting cardiovascular disease, it's not a good sign. Yeah. So I guess that's where we need to address as a society, what are we eating? What is our lifestyle modifications? How can we get early diagnosis? How can we get good treatment? How can we adhere to the therapies, whatever has been prescribed by our doctors, in a very, very sincere manner, so that the productive age group continues to do what is needed for the growth of the country, but also takes care of the family. So the health, I think, would play an extremely important role. And that is the reason why I think the government is also keen to increase the percentage GDP spent on healthcare, because everybody realizes a sick country, productivity goes down significantly. We have seen, right, wherever Dinesh is working if you have a team of 4 people, one is down, even for a viral fever, you see that week the productivity goes down. Think of a manufacturing line. Think of things which are rapidly increasing. So I think the health of the country is extremely important, critical for the economy. Yeah.
Thank you, Manoj. And the next question is from Mr. Ashish Kumar. And his question is, how do different cultural and social factors influence the legacy of healthcare? Thank you, Ashish.
Yeah, in some segments for sure. I mean, I think when you look at aging population, I think part of the misdiagnosis in India, one aspect is the doctor density, which Anish had beautifully asked. The other aspect is also sometimes if we have a pain in our knee, we will say, it's a part of aging, whereas today, if somebody goes for a total knee replacement, the technology, and the facilities in India are such that he can live a much better life. He can drive on his own, or her, she can walk to, her evening walk. So why to have a compromised quality of life? So I think sometimes the social fabric also plays a role, where people say, he's past 60, abhi to ghar pe baithne ki umar hai. Yeah. I think those things have to change, and are changing, So they play a role for sure.
Very good. And we have, I would say, 4 questions from Ms. Yash Gandhi, and with your permission, let me have them. His first question is, how does Bayer Pharma contribute to advancing healthcare, and what are some of the major initiatives currently underway? The second question from him is, how do you ensure that Bayer Pharma remains at the forefront of innovation in an industry that is constantly evolving? And the third one is, what advice do you have for emerging leaders in healthcare who are looking to make positive impact on the industry? And his last question, Manoj, is, what are some of the biggest challenges facing the healthcare industry today, and how is Bayer working to address these challenges? Thank you, Yash.
Yeah, I forgot about the first question, but let me quickly look at
his question is, how does Bayer Pharma contribute to advancing healthcare?
Okay. Yeah. No, I think with innovation. Yeah, recently in India we have launched 3 products. All are highly researched, innovative product, first time to market globally, and I think those launches or introducing has been a significant boon for the patients and for the healthcare providers. We have launched for kidney disease, which is chronic kidney disease for diabetic patients. We have come with a product which helps patients of heart failure when their condition worsens, which is a category called as worsening heart failure. We have also launched a product in prostate cancer in a particular type of prostate cancer, which is called as NMCRPC. Yeah? And up till now, these patients were not having good quality of life. So I think our, as Bayer being a research-driven company, our impact is by making sure that we are spending a significant amount of resources and midnight oil on things where we would really like to pursue, which are moonshots at times. When 10 years back, when we started looking at something for heart failure, when there are already good treatments available, it was a moonshot, right? So I think that's how we make an impact.
Okay. This is a question from Mr. Satyapal Manoj, and his question is: being in pharma sector, do you think world-class medical or costly medicine can be affordable to all people who don't have much income? Many times, all of us have observed that foreign pharma companies are selling medicine at very high prices. And with the same content, generic medicines are available at very cheaper rates. Do you see any business threat, or do you have any idea how to cope up with such situation? Thank you, Satya.
Yeah, I think, in the generics have a place in the industry. The similar is an innovative drug. There is a time period, for what you have exclusivity, and then the drugs are made generic. And as I think the question, which Anish asked me and I answered, sometimes we looked at that the access to healthcare or quality healthcare is only through a price of the medicine. Yeah. Which is not true. Access, and I gave the example of anemia, Dr. Nagen, right? Where the cost is nothing, but still there are lots of patients. So, drug prices are important, yeah. And for example, we price our drugs very differently in India than to the West countries, which we called as a philosophy of tiered pricing. So our pricing, including the recent new launches, which we did, are significantly lower to the price what is there in US or in the Western world. So that I think a lot of companies, including ours, take an approach to look at India very differently as an emerging market and what price point will come. But also, I think we all should keep in mind that access to healthcare, price of drug is just one component. We have also other things to really manage it well so that the patient gets to the optimum treatment.
Thank you, Manoj. And this is a question from Mr. Milind Begor, and his question is: how do you think AI, that artificial intelligence, can play a role in healthcare going forward? And is there any government program to promote AI in healthcare? Thank you, Milind.
I think there are several initiatives by government, both by the Department of Pharma, but also under the Atal Innovation. There are quite a few models where they are funding startups. Look, AI is already playing a very important role, yeah, both in managing the patient, helping in diagnosis, and you see some of the models which have come in where the diagnosis of the doctors are held by AI. So AI today is already there in a lot of softwares which we don't realize which doctors are using it or the hospitals are using it. For example, we have a significant business in radiology where we actually provide the software so that the data which looks at these are for MRIs or CT scans. The ability with the help of AI, the ability for doctors to really have a quick diagnosis or quick read is much better, right? So the AI is already playing a role across the board in healthcare, both from a diagnosis but also across the board, even in clinical trials. For example, how do you look at the data sets and then you apply the AI tools to really see how can you filter them much faster. Yeah.
Thank you. And this is a question from Mr. Mukbir Rahman, and his question is: how do Ayushman Bharat Digital Mission and PMJAY help in future healthcare scenarios, including medicines and treatment? Thank you, Rahman.
So, as I said, Ayushman Bharat to me is a great step. Yeah. If you look at India, there are essentially, we said there are two Indias, right? India and the Bharat. If you look from a pay, and if you imagine India as a pyramid, the top tier, the people who are affluent or who are upper middle class or high income group, I think they have access to good quality healthcare, right? With their because mostly is in the urban setting, they can figure out what is good for them. The middle class is something which tries to figure out, but they still go to public hospitals, right? Because they understand what is needed for health. Is the bottom of the pyramid, which was absolutely lost, yeah, and particularly when they have major surgeries at their home, they get into a crisis because they don't have a savings, and they were essentially doing either taking loans at a very extremely high interest rates, or selling their land, or selling their whatever assets they had. That 50 million population, or 25 crores, right? Family 25 crores people, 50 million families have now Ayushman Bharat, which actually ensures them. So it's a good safety net for all hospitalization. Most of the surgeries come under Ayushman Bharat, where even medicines are covered with that. Yeah, the cap is 5 lakh, which is significant. If you look at the average insurance in India, medical insurance, I think most of the people are taking 3 lakh to 5 lakh. So if Ayushman Bharat covers 5 lakh, it's quite good. So it's fantastic for people, and it covers a broad base. I think the government is now working on Ayushman Bharat 2.0, probably add another set of population or families into that. Yeah, and at some point of time, since it's only inpatients today, so when you are hospitalized, you can actually claim the Ayushman Bharat, or Ayushman Bharat covers it. I think at some point of time, my wish is the OPDs, so outpatients. So when you are sick, you don't need to be hospitalized. So you go to a cardiologist, you go to a nephrologist, and he gives you, some treatment. That sort of a consultation would also come in Ayushman Bharat, which is not the case now. Yeah, but it's a great step towards universal healthcare.
And this is a question from Mr. Nitin Gujar, and his question is the Delhi Mohalla clinic model is ideal for India to get more coverage? Thank you, Nitin.
Yeah. So, Nitin, my apologies. I don't know the Delhi Mohalla clinic so well, but I think it's my read about it. I have not been to Mohalla clinic, but my read is it's a primary care clinic, and what we also call in India is a PHC, primary health center. Yeah. I think multiple governments have looked at primary health center. We all know it plays an extremely critical role because those are your family physicians, which are in the community. So if you make them well, if that is staffed well, if there are good doctors there, if the facilities are good, the infrastructure is good, it should work. Yeah, and I think so. If the Mohalla clinic is a ideal sort of a primary healthcare center, it should work, and that's how I think we have seen in many other states as well.
Thank you, Manoj. And this is the question from Mr. Ashish Kumar. His question is, what can we learn from the countries with healthcare systems to improve healthcare globally? Thank you, Ashish.
Yeah, so a couple of things. I think countries which have done really well on healthcare, diverse countries. If you look at, for example, in some of the Latin American countries or other emerging countries, China is a good example. Yeah, to what an extent they spend money or GDP on health. So I think we have to really increase our allocation to health, both the government, but also I think as individuals, we have to really prioritize our health. Yeah, we have to really take care of our own health as well. So I think that is number one ask. Second is I think we all can really see that India is a pharmacy of the world, right? So from a healthcare, India is on the map, but somewhere, when we look at individual health, our parameters are not so good. So I guess that, how can we really look at, how can we, have an impact on societal health, what we can do, whether it's lifestyle modifications or other things, yeah. And lastly is around the whole focus of, which we talked about, and I think we are at the cusp where digital innovations we are seeing is how do we really embrace digital? How do we become digital native and use in healthcare? We are already seeing, at least in the urban setting now, people are used to it, but probably in the rural or semi-rural as well. Yeah.
And this is the question from Mr. Ruben Das. And his question is, in India, we lack data when it comes to patient history, which at many times leads to wrong diagnosis of patients. How do you see digital changing it? And how should be leading this transformation, the government or the private sector? Thank you, Ruben.
That's a wonderful point. I completely agree. I think we are moving towards uh, getting more data. Yeah. We don't have one platform as such, but if you go to a good hospital setup now, or even a polyclinic, even individual doctor setup, I think the EMRs are, which is electronic medical records, are there. A lot of doctors are keeping that, which helps them to really track their patients. So it is, I think, digital ecosystem is also, getting better. I mean, just see telemedicine. There were no guidelines before COVID, right? So no regulations. And and I really appreciate government there. They were quick to come up with telemedicine guidelines immediately within first or second month of COVID. Yeah. So I think that if you do telemedication, everything is there on the digital. Yeah. There is a trail, and yeah. So I think the outlook is absolutely, and I think government has also started the mission on that. During the COVID, we all used an app, right? Our certificates are digital. We can go anywhere and do the scan the QR code. Our vaccine certificate pops up, which is also one thing which is used in digital. And I think that could have been used. All the electronic records can be done easily. So I think we have the right model and the framework. Yeah.
And we have question from Mr. Manoj Kumar. In fact, two of them actually. How to improve cost efficiency of medical treatment? That's the first one, Manoj. And the second one is your views on improving trust factor between patient and medical fraternity. Thank you, Manoj.
Yeah. So let me answer the first one first. Yeah, that is right. I think we haven't communicated that much that what pharma industry has contributed to the society. Yeah, and that's the reason why the trust is not there, or the trust deficit is there, if I can use that word. And probably we have to really go to the communities and talking about how much time it takes to really come with the innovation. It's a complex world. And what has been the impact? Yeah. Some of the diseases, 50, 60 years back, forget managing. There was, today are being cured. Some of the cancers have gone. Virtually, you can live cancer free now with the modern management or the modern techniques and modern drugs. Yeah. So the impact what in the innovative industry has done is immense. But probably I think we are at fault. We have not been able to communicate the good things as well. And I think that we look at it. How do we become more patient centric? Examples like we have to understand what patients are looking at, right? We look at sometimes from our own view, but also understanding and hearing patient voices. For example, in India, in endometriosis, we are now having a patient group where we understand from them and what the disease is, how they manage it, what can be done. We have a patient advocacy group as well. So I think those initiatives would also help to bridge the trust deficit what is there. What was your first question, Dr. Nagen? Sorry,
the first one, how to improve cost efficiency of medical treatment?
Yeah, this encompasses many things, right? So the first cost is the cost of reaching, who moves, yeah, whether a patient moves to a doctor or doctor moves to the patient. Yeah, both the models are there. Now with digital, the doctor is moving in the house of a patient. But at times the patient has to visit a doctor. If the doctor is 50, 100, 200 kilometers away, that's a big cost. Yeah, that sometimes that cost is bigger than the cost of consulting a doctor. Yeah. Then at a secondary tertiary care center, if there are referrals, if a patient has come for a gastroenterologist, but he has to also see a cardiologist, he also has to see another doctor. And if those doctors are not sitting in one place or the access is too difficult. Yeah. So I think that is one. Then how do and when do you use innovative therapies, techniques, surgeries, many things, right? Where sometimes the upfront cost looks very high, but then it devoids the other costs, which was the part which we covered in health economics as well, right? So and all that if you juggle together, you can drive cost efficiency.
Thank you, Manoj. This is a question from Mr. Deepak. His question, sir, does Bayer has public health division?
What do you mean by public health? Whatever we are doing is everything is for the public health.
Okay, so this is a question from Dr. Siddharth Khare, and his question is how to cope up in present inflation in private practice in dental healthcare industry.
Yeah, I mean, look, I don't have anything in the dental sphere as an organization, so it would be very difficult to comment. But I think inflation in general something which we are seeing across the board. Yeah, I mean, as an economist, so I really can't comment on the dental side, but in general, there is inflation. I think everybody would look at it. How do they manage the cost while driving the efficiency? Nobody wants to increase the cost of the product. But at the same time, we have to be mindful as to, I can't really talk on behalf of a dentist, but I think whosoever is increasing the prices is looking at what is their cost of operations, and based on that, how to what an extent they can pass it on to the patients. Yeah.
Okay, so Manoj, with your permission, we already hit 2 minutes past 7 o'clock. With your permission, can I take 2 more questions?
Sure.
Yeah. In fact, Deepak has a follow-up question, right? And his question related to the public, health division. His questions on what are the scope for senior public specialists who are also medical doctors to contribute for buyers' efforts in healthcare? Thank you, Deepak.
No, that's a very good question. Yeah. So actually, we have in-house a lot of qualified doctors who help us to understand the medical science. Because essentially we are a company who does drug research. Yeah. But how do we really communicate to the healthcare practitioners who are clinicians practicing those? The bridge is our medical department. We have so if somebody is keen to join Bayer, they can always reach out to me. But they can also visit our website and apply there. So that is one way of working for Bayer. The other way is our major stakeholder when we say we are patient centric, we want to give the best outcome to the patient, is via doctor, because all our drugs are prescription products. Yeah. So we also build relationships with the doctors in a way that we call it a knowledge-based relationship. Where we learn from the clinicians how are they managing their patients, what are their difficulties, what are their challenges, and we communicate to them what are the innovations, what is happening in the global, what new products we are bringing in, and that knowledge-based relationship also helps to manage the patients well. Yeah. So I'm more than happy to connect with some of the doctors if they are keen and link up with our medical team so that they can also help us to propagate the right science. Because there is also a Google doctor, right, which patients treat, and we don't want the patients to get to the wrong doctor. So if there are doctors who help us to reach and propagate the right information to the patients, we are more than happy to work with them.
Okay, so we have the last question for today, and this is from Zainab Hashbi. Our question is, what's the impact of culture on healthcare leadership? Like, how do we deal with patients from different countries and cultures? Since India has great healthcare facilities and people are coming to India for good treatment, so how do we manage them? Thank you, Zainab.
Yeah, this is a question I think probably best addressed by a hospital setup. I think her question is more on medical tourism, that a lot of patients are coming. There are many reasons they are coming to India. I think the Indian doctors are fabulous. We have seen, at least 1/3 of the doctors are of Indian origin. Plus, now the facilities in India, the infrastructure, at least in the private area, is becoming very, very good. And thirdly, they get quick appointments in India because the waiting period in Western world, and for example, in UK, if you have to get a root canal done, I think it takes a month or 2 months. Yeah. In India, they can call up and they can get it done in a week's time. So I think the whole efficiency and a quality care is unparalleled, and that's the reason why a lot of patients are coming to India. The culture plays a role, right? I mean, when we say we want to give a better quality of treatment, being empathetic, being from an understanding of what patient care is needed. Yeah, I think that plays an important role, and probably the society plays a role there as well, right? And in our society, I think care is important pivot. and value system in our society. So probably that also helps. Yeah. And on that, because I think there was a question around what emerging leaders can do. I think that is a pitch for me, that for youngsters that do join pharma industry, it's a great profession and a great industry to work with. A, there is a purpose. B, you also see the impact which you are creating by helping millions of patients get to the good treatment. You see pain being taken away. You see patients are smiling. So I think it's and that compassionate and empathetic view is generally not seen in any other industry. So just sideways to also a little bit advertise about the pharma industry.
Absolutely. Thank you so much, Manoj. I'm sure there are a lot of questions. I think Yash has got 2 more questions, but then we should say really the participants of the day, right, for Yash. But thank all of you for being for today's session, and thank you so much, Manoj, for your time, especially on Saturday evening, and especially joining us from a very remote area in middle of Madhya Pradesh. But I think, like you rightly said, that speaks a lot about the kind of work that you and your team have been doing. Thank you once again from all of us. Thank you, Anish, also for sparing your time on Saturday evening. But it's been a great conversation on building world-class healthcare in the light of Bayard. Thank you so much.
Thank you so much, Dr. Naren, for having me. I really felt honored and privileged to come on platform of TimesPro. You guys have been doing a phenomenal job in helping anyone to continue their learning journey. Yeah. So thank you for having me and hearing our part of the Bayard story. Thank you, Anish, for engaging conversation, and looking forward to some other day as well. Coming to
Absolutely. And thank you so much for being so generous with your time and your views on behalf of the entire TimesPro student and staff fraternity. We really enjoyed having you. So thank you for being here, for your candor. And like you said, I would love to do this face to face sometime soon. Once you're back in, I don't know, Mumbai or Delhi or anywhere.
Sure.
Would love to carry on the conversation. But thank you, and good night, and have a good weekend.
Thank you. Thanks, everyone.
Yeah. Thank you,
everyone. Thank you, Dr. Chaudhary.
Thank you so much, everyone. Thanks.